So this is the left atrial appendage and right atrium, right atrial appendage coming next to the left atrial appendage. Operative factors to be considered, two main things are the ventricular dominance, that is there must be no RV, LV hypoplasia. Position of the VSD, not only position, number, type and position. Presence of the pulmonary valve morphology. So the new aortic valve is the pulmonary valve morphology. Very important is the coronary artery anatomy. Not only these factors, but in the presence of late surgical indication, pulmonary artery pressure without reversibility, and LV wall must be trained or conditioned for a systemic pressure. So a posterior wall thickness less than 3 mm or reduced LV mass or reduced LV contractility, we may not be able to offer arterial switch operation, which is the anatomical repair, is the definitive repair, which is the gold standard for a DTGA. So during presentation, you can see this is an usual chest X-ray of a DTGA newborn. There is thymic shadow. After the regression of thymic shadow, the vascular pedicle is narrow because there is no side-by-side relation of pulmonary artery. Aorta comes directly in front of the pulmonary artery. So narrow vascular pedicle with a mild cardiomegaly, and the vascular markings are increased. You can see the vascular markings reaching even up to the lateral 1/3. So this also is a pointer for diagnosis. Cyanosis but increased pulmonary vascular markings. So this is a diagnosis of DTGA. So this is classically called as egg on string. So this is the string and this is the egg. Appearance of a DTGA X-ray. ECG similar to any cyanotic heart disease. Presence of right axis deviation, right-sided predominance. You can see the right ventricular hypertrophy, R wave taller than the V wave. And in V6, presence of a Q wave means there is a large ventricular septal defect, that is LV is overloaded. Absence of Q wave, there is less intercirculatory mixing at the ventricular level. So Q wave in V6 is large VSD. And like any other disease, left axis deviation with PR segment prolongation means it is the AV canal defect type of inlet type of VSD associated with DTGA.